still trickle in. But in the interest of time with our amazing speaker, while we have this time together, I want to get started. So I'm just going to give a little intro and then turn it over to Professor Roberto to speak. So I'm Emily Broadleave. I'm the director of the Food Law and Policy Clinic and the Center for Health Law and Policy, which also houses the Health Law and Policy Clinic. And those two groups, along with the Food Law Society and Health Law Society, are sponsoring today's event as well as a series. So this is the first event in a series of events on kind of food and health and chronic disease. So today we'll be talking about ultra-processed foods. In a couple weeks on March 26th, we'll be talking with someone who is on the U.S. Dietary Guidelines Advisory Committee about the dietary guidelines. And then on April 10th, thank you, we'll be talking with Dr. Dari Mozaffarian about GLP-1 drugs and like how those are impacting food policy, health, nutrition, eating habits, those kinds of things. So I want to, in addition to thanking our sponsors, thank Audrey Khan, who's a fellow in the Food Law and Policy Clinic, who helped on today's event. And I want to introduce our speaker and then turn it to her. So Christina Roberto is Mitchell J. Blutt and Margo Krody Blutt, Presidential Associate Professor of Health Policy at the Perelman School of Medicine at Penn. What a long title. She's also a dear friend. We actually both started at Harvard. She at the Public Health School, and I was here as fellows at the same time. And so now we've kind of spent a lot of our career, you know, looking at these issues from like the legal and policy side, and then from the public health side. She's the founding director of the Center for Food and Nutrition Policy at Penn, which brings together researchers from across Penn and the Children's Hospital of Pennsylvania to really think about and develop innovative policy solutions to food system challenges. And you'll hear a little bit more about our work, which is really about thinking about like the research and evidence base for policy change to help how we can partner better across these two fields to really think about and develop better policy change that's evidence-based. So I think I'm going to turn it to you to give a little talk, and then we're going to do a little bit of like moderated fireside chat, and then we'll open it up to everyone for questions at the end. Okay, sounds great.
Hey everyone. Thanks. I'm so delighted to be here. It's really, really interesting time to be talking about ultra-processed food policy. There's a lot going on, so we'll discuss. Okay, so I want to just kind of give you like the basic thing that drives the work that I do, which is the fact that our food supply essentially has toxic levels of sugar, salt, and fat. And it's not rocket science. Those foods are delicious, right? They're just addictively good. And so it's incredibly hard for the vast majority of people to stop eating them. And the food industry is really masterful at making us think the unhealthy stuff is actually kind of healthy, right? So it's golden grams on it, we'll have lots of claims, no artificial flavors or preservatives, right? But it's packed with sugar, for example. And so one big kind of framing issue that has come up, if you follow food policy, but even if you just read the news, we're starting to see this term ultra-processed food take off. This was literally from a couple of weeks ago in the New York Times, a quiz that you could take, are ultra-processed foods in your cart? And traditionally, we really thought about unhealthy foods as these ingredients that are in them, right? The added sugars, the saturated fat, and those are the things we want to focus on. What's interesting about the ultra-processed food framing is it's trying to take into account whole foods and point to certain whole foods as the culprit of fueling this diet-related disease epidemic that we have. So why do we overconsume these ultra-processed junk food, and why do I think it's helpful to frame these foods as ultra-processed? I think it's because it really goes much further than just the ingredients in the food, right? It's like the whole experience, right? So it's the taste of these engineered foods, the mouthfeel, the price, they tend to be very cheap, the accessibility, like you can't walk into a Home Depot, right, without getting exposed to ultra-processed foods, the colors, the added flavors, right, that entice us, the packaging, right, and the marketing campaigns, many of which now are highly targeted, and it's always there for you shelf stability, right? So if I bake brownies in my house, after a couple days they're gonna go stale, it's not gonna be that appetizing. But if I buy them, right, they can be in that pantry for weeks, months, and they'll still taste good. So there's been increasing attention in trying to tease apart and understand, well, is there really something specific to these ultra-processed foods as opposed to the brownies I might bake? There's a lot of definitions floating around of ultra-processed foods, but if you want to take the most simple one, it tends to be like a food that you couldn't make with just the ingredients in your kitchen, right? So researchers are trying to figure out, well, what if we compare ultra-processed food diets to diets that are essentially equivalent in calories, saturated fat, sodium? Like, is there something about these ultra-processed foods that actually fuels overconsumption and fuels weight gain? So Kevin Hall did one of the first and one of the only studies we have where he basically randomized people, 20 adults, in a random order to consume a diet of ultra-processed foods versus a calorically equivalent diet that has the same nutritional composition, but they're minimally processed foods. And I'll just show you the graph of the results. You can see calorie intake on top, and you can see weight over just 2 weeks between these two diets. And what you basically find is that these ultra-processed foods, people eat more of them. Like they are tastier, right? People are consuming about 500 calories more on average, and that is leading to more weight gain on an ultra-processed diet. Okay, so given the situation with our food supply, having worked in this field for about 20 years now, I really feel like there is just not an incentive system here for the food industry to change. There just isn't. And so we really need pressure, things like lawsuits, which is how we achieve a lot of public health victories, right? And policies that are going to restrict access to the promotion of these unhealthy foods. And I just want to make a point that it's not that I'm not wholly in favor of supporting consumption of healthy foods like fruits and vegetables, but historically, we've tended to think about how to do that and have ignored this much bigger, harder problem, which is getting people to eat less of the unhealthy foods. And when we incentivize consumption of fruits and vegetables, people tend to eat a little bit more, incentives work, but that is not, half cup more apples a day is not going to reverse type 2 diabetes. It's not going to drop our cardiovascular disease. We're not going to see reductions in blood pressure. So I really think the conversation, if we're serious about addressing chronic diseases, needs to largely focus on the unhealthy foods, because that's what we haven't touched in 50 years. Okay, so but this is an exciting time. Part of the reason we're here is there is a lot going on in food policy right now. So, and Emily will speak more to this, 11 food companies have been targeted in this ultra-processed lawsuit, so we'll talk a little bit about that and see where that can go. And then we'll talk about RFK and sort of what's happening with MAHA. I'll just spend a minute telling you about our center, right? So, you know, we love this home world without preventable diet-related diseases that's powered by a healthy food system. Because so many of our chronic diseases right now in the US, it's smoking and it's diet that are driving that. So at the center, we try to identify and evaluate policies and interventions that promote healthy diets and prevent nutrition-related chronic diseases. And we have 4 themes of the work. So we try to advance health by addressing not only social determinants of health, but commercial determinants of health. So by commercial, I mean the food industry. We do a lot to integrate insights from psychology and behavioral economics. We think a lot about how to design policies based on those insights, because the details really matter in how policies are designed. We use an approach I call strategic science for policy impact that Emily and I will chat about in a little bit. But essentially, we're just very intentional as researchers about reaching out to policymakers and getting their input into the research questions we're asking to make sure any research we're going to do is going to be highly relevant and usable by policymakers. And then we do a lot of work on actually the measurement and diagnosis and understanding of eating pathology, including work on GLP-1s that I'd be happy to talk about. Okay, so the second half of this talk, well, let's start here. It's weird. It's a weird time. You're in public health. You know, let's talk about what RFK is doing in terms of food policy. He's obviously an extremely controversial figure. Vaccines are one of the greatest biomedical inventions in human history and have saved countless lives. He's been, you know, spreading quite a lot of misinformation about that. All of that is super concerning. Even within food, there's like quite mixed, you know, points he's making. Raw milk, he was just linking measles to diet and health. So there's a ton to be concerned about. Here's what's kind of weird though. It's also tied up in some other messaging he has that
has been really interesting that I actually think we really need to make progress in this space. Right, so here are quotes from his confirmation hearings, right? Food makers have been permitted to mass poison American children. That's wrong, it needs to end. American kids did not suddenly get gluttonous and lazy, something is poisoning them. That framing is actually hugely important because in this country, obesity has historically been attributed to lack of willpower, right? There's been tons of weight stigma and shame. And now we have a policymaker, again, I'm surprised to be saying this, who's actually framing this issue and really targeting industry in the way that I think it needs to be targeted. And if you look at his priority areas, again, I'm in agreement with quite a lot of them, right? Make sure tax dollars support healthy foods. Ban the hundreds of food additives and chemicals that other countries have already prohibited. Remove ultra-processed foods from school cafeterias. Wow. Change regulations, research topics, and subsidies to reduce the dominance of ultra-processed food in the food supply. Revamp federal agencies that work on food policy. Remove financial conflicts of interest, which is a huge issue in food, from things like the dietary guidelines. Wow. Now, no idea if any of this will get done, but it is some really powerful messaging. And I just want to propose in this talk, I think the tobacco analogy is super relevant for food, and tobacco is one of our greatest public health successes, right? So we know more at this point about the addictive potential of food than we did when the Surgeon General wrote that landmark report about the addictive potential of tobacco. Right? Like, there are over 400 studies, this is well established now. So in my view, I see no reason why we shouldn't be making the case, and that's why that lawsuit is so encouraging, to really treat big food like big tobacco. And I'll just finish with some ideas here on what worked in tobacco and what the analogy, what the analog is in food. This worked. We did taxes. We had clean indoor air laws, warning labels, marketing bans, counter-marketing, meaning negative industry campaigns, and pre-market review of tobacco products. So what if we map this onto food? What would that look like? Taxes of sugary drinks. My group has done a ton of work on this. They're extremely effective. We can expand those to ultra-processed foods, and I can show you data in a moment. We limit the sale of single cigarettes to limit youth access. We could stop selling single-serve sodas or limit multi-buy deals that make it easier for kids to buy sugary drinks. Just to give you a sense of the power of taxes, Philadelphia implemented a 1.5-cent per ounce tax on sugary drinks. We did a study looking at sales data from large chain retailers, and if you look at the volume sales of this graph, Phillies and Red Baltimore, our control city, is underneath. Tax goes into effect on the dotted line. You see this massive 50% decline that persists. We've seen it persist for 2 years, which is where our data goes to. Yes, over here you see some cross-border shopping, meaning that the places in blue that border Philly see a little increase. People avoid the tax by shopping in neighboring counties that don't have it. But even once you net that out, taxes produce a 35% reduction in sale of sugary drinks, which is a huge behavioral effect. Like, if you study food, it's notoriously difficult to get people to shift their eating habits. And then I'll briefly show you that we've now done studies linking electronic health record data, right, to our data on the tax. And we're basically able to show that a reduction in dental caries in Philadelphia, not among everyone, just among patients that are on Medicaid, which is great because that's our low-income population that has a higher consumption of sugary drinks at the beginning. So now we're starting to see health effects of these taxes. Warning labels, right? We've done a ton of work on warning labels. I'll give you one example. We randomized a nationally representative sample of almost 1,000 caregivers to do a task where they had to pick a beverage for their kid. You're either seeing a calorie label, a warning label that warns of the health harms of sugary drinks, and then taking from the playbook of tobacco these graphic warnings, displaying sugar, and even going so far as to display some of these really more graphic ones. I'm just going to quickly show you this result. People in this study actually have to pick a beverage for their kid. And what we see is, this is the percentage choosing an SSP for kids. The text warning does not make any difference, but we see a really large drop in the number of parents selecting a sugary drink when a sugar warning is on there or a health warning. And that's actually good news, because the sugar produces just as big effect as that more aggressive health warning, which would be legally harder to achieve, right? Okay, last
A couple of examples, negative industry campaigns. We recruited almost a little over 1,600 Hispanic parents, and we randomized them to be exposed to campaigns on Facebook. So they got this fruit drink counter marketing campaign that I'll show you in a minute that was designed to really expose the way industry misleads consumers. We coupled that with water promotion messages, and then we compared it to a control group where we just shot out car safety messages through social media. And then and this is an example, like we had a marketing firm design this campaign. So some of it is warning, some of it is just trying to expose, like what industry is telling you this is all natural, it's not really, etc. And then we went to look to see the percentage of parents in a shopping test that chose a sugary drink for their kids, and we measured their kids' beverage consumption. And what we see here in the control group, we need a control group because over time parents do select fewer sugary drinks for their kids. But man, there's a much bigger drop, almost a 14 percentage point drop when they're exposed to this negative industry messaging. And when it's combined with water promotion messages, you get almost a 20 percentage point drop in parents picking these drinks for their kids. Right? I would argue clean indoor air laws, what's the analog? Well, we could limit exposure. We could have clean environment laws or limiting exposure to ultra-processed foods in places like schools, daycares, workplaces, hospitals. Why do hospitals sell junk food, right? Have you been to a hospital cafeteria? Right now, there is a huge push for food as medicine in healthcare, right? To get patients access to fruits and vegetables. Should not a central tenet of that be that hospitals should serve healthy patient meals and have healthy cafeterias? But they don't. And then finally, and Emily will talk about this, we should be doing more FDA pre-market review of food products just like they do with tobacco, right? Companies can add new substances to food without FDA review or notification, which is something I learned from Emily, from a great article she wrote, right? And I read that article, and I was like, what? Like, I texted her, to be like, what is going on, right? And she wrote this beautiful piece in New England Journal that's like, yeah, companies are putting terra flour, right? And it's making people sick, and people are getting hospitalized for this, right? And that's the nature of the way we regulate, so that has to change. And then the very last thing I'll say is, we can also be regulating the amount of sodium in our food supply. There are voluntary targets for sodium reduction sitting with the FDA that have not been made mandatory. Over 40 countries around the world do this. You can buy the same cereal in the UK and we'll have less, sodium, sugar even, than in the US. Why? Like, that means companies can do it. Why are we not doing this? We know that it would reduce population level blood pressure because other countries have done it. So I want to leave you with just, there are a lot of solutions here, and I think it's a very interesting time, and some of these we might actually start seeing some activity. So, all
right, so I'm gonna take us through first of all, there's too much to talk about, but a little bit, and then we'll open it up so everyone can ask questions too. Come over.
Oh, yeah, let me do this.
Oh yeah, oh no.
All right, maybe I'll do this.
Sit all the way over that. Okay, so I'm gonna start I think the place I want to start is actually the definition of ultra-processed foods because you kind of started from there, and before we get into some of the solutions, I think, one of the big things that's been going on is just this question of how do we define them? And so I think there's some things where it's you know it when you see it. There's some things we know when we see them, our lunch is not ultra-processed. But I do think as a lawyer, and most of our audience here as law students, one of the biggest questions is a line drawing question is if we're going to try to regulate something, where's the line? And I was looking again last night, most people who define ultra-processed foods, they use this NOVA classification. And the NOVA classification is there's 4 categories. There's unprocessed, minimally processed, processed, ultra-processed. The line between group 4, which would be where we'd regulate, I think is blurry. So it's industrially manufactured food products made up of several ingredients, including sugar, oils, fats, and salt, generally in combination in higher amounts than in processed food. So that's the line, in higher amounts than this other category, but there's not, saying more. And then, it goes on. I'm not going to read the whole thing because it's several paragraphs. So I guess my question for you is do you think we know enough? Is there a way to draw a better line there? And how much is the fact that we don't have a great line impacting some of the great evidence-based solutions that we're looking at?
Yeah, I mean, I think this is a key question for policy because you cannot implement any of these policies without this definition. And so actually researchers are trying to scramble right now because policymakers are quite hungry to understand, like, if we even do this, how would you do it? And of course, like, everyone has their opinion and the research field, whatever. I don't have an answer. I can't tell you this is how to define it. I am working with a colleague who has a ton of experience creating definitions, working with the New York City Department of Health, for example, because this is a solvable problem. When New York City has to do their procurement guidelines on what can and can't be purchased with government dollars, like, they have definitions, they apply them, and use that. So I feel like we can figure this out, right? And I don't want people will be like, no, but this one whole wheat bread would be considered ultra processed and it should, and like that shouldn't stop us. This is solvable, we'll come up with some algorithms, maybe it'll make some mistakes, it's not gonna be perfect, but we do just need to spend a little bit of time, and this is a doable criteria we can create.
I think that's right, and I keep thinking like it's such a great opportunity for this like cross-disciplinary collaboration. Like we, in this room, like in our field, have this sense of like you have to figure out the lines, and maybe the lines aren't going to be perfect, but you need something. And I kind of am looking at like from the outset this debate going on in like the public health sector, where I think people are like I just was reading something yesterday. It was like, well, if the definition includes hummus, and people won't know that hummus is good for them because it's an ultra processed food, or we won't know if it's like flavored yogurt versus regular yogurt. And so I think I guess just follow up to that. We'll be talking in a few weeks about the dietary guidelines. So one big thing that happened is the Dietary Guidelines Advisory Committee was asked this time around to look at like should the dietary guidelines include some criteria for ultra processed foods or include some guidance on that, and they sort of declined. And I guess I don't know, do you think like with expertise in public health, like did they make the right call there from your perspective? Sorry to put you on the spot.
No. This is my worry with the whole ultra processed food debate. Is that it's going to make it seem like it's going to cast doubt on what we've known for decades about what's a healthy diet, because we haven't studied this exact concept and figured out all the components. And so the Dietary Guidelines Committee was basically like, we don't have enough evidence to make recommendations. But like, all of these ultra-processed foods are really high in added sugars, sodium, saturated fat, and then they have these additives and colors, which there's, you can get a toxicologist in here, there's independent research on the negative effects of those things, and cancer, and so we have plenty of evidence that this type of diet is not good, and as a scientist, I don't need to attribute it specifically to the processing or perfectly understand that before we should take some action. So I'm very worried that actually the industry, while public health is fighting amongst itself on the perfect definition, industry will really exploit that and help fuel the message that like, we don't know, we don't have enough evidence. But it's similar to the Mediterranean diet. Like, it's a basic pattern of eating that we know is associated with health. Eating a bunch of Doritos, Cheetos, Oreos, whatever, we know that that's not good for you. And so I do think we have enough evidence, at least for reasonable action.
I would agree. And I would agree that we have enough to be able, if the recommendation then is to say people should avoid this group of foods, I do still think looking at it like from a legal perspective, if we then want, if we want to actually regulate around like these things can't be served here, can't be served there, we actually are going to need like a more bright line.
And I actually, sorry, just on that finally, that's why it would be good. What's happening right now at FDA is they've introduced a proposed rule for front of package food labeling. And it would actually be a good moment to incorporate this concept because that will require a definition. And then once that label is on the whole food supply, it also makes the implementation of all these policies much easier. Because if you're a food service staff or if you work in a procurement office, like you just know label not, label not, label not. But anyway.
We'll see if they do it. I know. Well, actually, that's a good lead-in because I was going to say, like, picking up on your thread about RFK and, like, what to expect. I mean, I totally agree on the, and especially, like, coming from our center has a food law and policy clinic and a health law and policy clinic. And like, I care also about public health deeply, but it is interesting if you look at his positions on different things, I think you can come to a really different conclusions. I want to dig in a little on, like, do we think that this is he going to be able to do the things he says he's doing? In part, do we think it's a real commitment? Like, is it possible? What are the other forces against it? And then I think in part because it's so out of line with like a lot of the other, goals of this administration. So I'm curious, like, are you more optimistic? Are you more pessimistic? Like,
Yeah.
and like, could he screw this up even if like the stated goals are good?
Well, yes, the answer to that is yes. Yeah, I mean, I've been thinking about this because, I don't know those of you who listen to Ezra Klein's podcast, but recently he was giving the example about Trump and, how he just kind of looks for loyalists was his point. And he was saying, take RFK, like you cannot find someone that hates seed oil more than that guy. And then the head of USDA, it's like his seed oil, like love it, right? Like it's huge into seed oil. And so, I don't think Trump has like adopted RFK's, positions, and I don't know if actually how much power he'll have to do, also like he's not gonna control USDA, right? So I don't know. Also, what he's messaging is that we have to take on industry. It's not like this administration has this amazing track record of taking on industry. What I do think, even if nothing happens, because mostly in this space nothing happens, like we haven't made a ton of progress. The change in messaging and the change in the narrative, I do think will have some lasting important effects. I think in vaccine, it's very troubling because even that narrative is having lasting effects. In food, it might be more positive. And then the other thing we're seeing, which is kind of remarkable, states, like red states, are introducing policies now, left and right. Get ultra-processed foods out of schools, restrict soda from SNAP, like things that we would never think would come out of places like Texas, which are happening right now. That's an interesting piece.
I'm gonna give an update on that because I have the data from like a call I was on last week. So this legislative session, there are 88 bills in 31 states related to like additives, dyes, and school meals, etc. 42 additive bans that would ban, particular additives, including one in Massachusetts that's coming out that we've been working on in the clinic supporting them. 26 bills that would ban certain color and dyes in school foods. And I should say both of those elements were passed by California in 2023 and 2024. So states are building on those, but they're going like way further. Like a bill in West Virginia that was passed. I can't remember if it was passed by both houses, but like was passed with overwhelming support. Went further than the California one. And then 4 of them are bills that regulate generally recognized as safe, which you mentioned. So this sort of loophole that if you want to put an additive into the food supply, you typically, like the process that Congress set out was that you have to go through, you petition FDA, there's a notice and comment rulemaking, and then they pass a regulation allowing that additive. However, if your substance is generally recognized as safe by experts in the field, then you can skip that process. And the crazy part is that the companies are able to they're like, we've decided this is generally recognized. So what we're seeing a couple states, for example, a bill in New York would, to get around that, require companies to disclose any generally recognized as safe substances they're using in food that they haven't notified FDA about. So FDA does have like a voluntary process to notify them. But anyway, it's like it's crazy. I mean, it's sort of like this huge snowball effect. So I don't know if, this is sort of what you're getting to. What I'm feeling is like, even if like RFK is unable to do the things he's saying he wants to do at FDA, the train's going.
Yeah.
And like we're seeing states do things, we're seeing like a lot of change in the discussion, and I feel like that you can't put the genie back in the bottle.
Yeah, no, absolutely.
The other thing I was going to ask about was the lawsuit that you mentioned. So I want to say a little about that for those who don't know, and then we can talk about like what thoughts on that. So there's for those who have taken food law with me or now with Trevor Finley, or I know Professor Hansen also talks about the Perelman case. So this was like the typical, really the only case where we see a court reacting to litigants suing over obesity, over ill health coming from food. And like a big takeaway from the case was that the judge really said, we don't think you've proved causation well enough. We don't think you've laid out these claims. I mean, also people eat a lot of things. How can you say, in that case, it was just against McDonald's? So there's new litigation was filed last year. kind of on the opposite end of that, the plaintiff is a 16-year-old who has type 2 diabetes, non-alcoholic fatty liver disease, and is suing Kraft Heinz, Mondelez, Post, Coca-Cola, PepsiCo, General Mills, Nestle, Kellanova, Kellogg, Mars, and ConAgra. Kind of pulling them all in, and the I don't know if I can get into more like the case a little bit. Your thoughts on like, is this a good thing? Is it a bad thing? Like, do we think that like they're all culpable?
Yeah, I mean, and I would love to hear more of your thoughts. Yeah, I mean, big picture when I step back, I mean, I had that slide up there because I feel like when have we gotten public health wins? Like, tobacco was a lawsuit, opioids was a lawsuit. Again, like, there are not really incentives. I mean, maybe now we're gonna see more activity. So when I saw that lawsuit and how broad it was, like, as a person who doesn't know anything about the law, like, it was very encouraging to feel like, okay, well, maybe some smart lawyers, like, you're my hope, can figure this out, because I do think this is like the most effective path, or like our best hope to get really broad change in this area. So that's what I would actually love to hear from you, like how likely is this?
How likely is it? I mean, for a bunch of reasons, I think it is. I kind of am on the fence. Like, I actually think, and if anyone's interested, this was the cases Martinez versus Kraft Heinz and others. I think that like the complaint is like a masterpiece. I mean, it is like really well written. It's really well argued. They have great supporting public health documentation. So you mentioned like they talk a lot about addictive qualities of food. They go into a lot of detail about that. They talk a lot about that it targets children in particular. That these companies were like on notice, like they had actual knowledge that they were harming health, and they continue to do this. And then also that it has a lot of detail about them, like the research that the companies do to get people to eat more, even unconsciously. Like it's not even testing, like, do people report that they like something? It's like really affecting them at this unconscious level, which like I would love your take on, like, do you how strong you think that data side of it is. So I think that whatever the impact, it's sort of laying out a lot of things that I think hopefully will either be successful or will start a lot more of a new dialogue that like brings us forward from where we were with the Perelman case, which I felt like was a little one-dimensional, to like a much more rich discussion. And again, whether it's this case and and the goal also would just be to get to discovery, because then you can try to get a little more information from the companies. So I think my sense is there might be a good impact, whether or not it actually has the intended impact of being successful on the merits.
Alright, that makes me happy.
Yeah, but your thought on like the science behind like, the addictive side of things. I mean, you said you think it's like really strong. Like, can you elaborate more on that side of it?
Yeah, I mean, truthfully, it's funny. I think back when I started in grad school, I was working with Kelly Brownell, who was really one of the first people to even put forward this idea that food could be addictive. And a close colleague and friend of mine, Ashley Gerhardt, is kind of a key scientist that really started research in this area, helped found this field. And at the time, I remember being super skeptical. Like, I don't know, I was just like, I don't know about the analogy, like, could it be? And, now 10, 15 years have passed. Tons of studies have been done that have certainly won me over. And even just as my thinking has evolved, like, now it just seems so obvious, right? Like, it has such, we don't binge on apples, right? We can't just like feel like I just can't stop eating these carrots. Like, it just doesn't happen, right? Like, I can't have Oreos in my house. Like, I will eat all of them. Like, they are delicious.
Now we know your guilty pleasure.
Yeah, I mean, like, they're just too delicious. And so what was interesting is there was a lot of scientific debate about it and skepticism in the scientific community, because we really do need the evidence to really prove something. But if you just walked out on the street and talked to people, they're like, yeah, of course chocolate's addictive, obviously, right? But now I think we have passed that threshold. Like I said, there's over 400 studies. One really exciting thing is actually Ash and some other colleagues are petitioning the DSM, the Diagnostic and Statistical Manual of Mental Disorders in psychiatry, which insurance companies use to reimburse, and to actually get food addiction as a clinical diagnosis. But like any clinical diagnosis, there's a spectrum, and I think we're in a situation where we have enough information that companies are purposely manipulating these foods to make them so appealing and make them addictive, that I think, enough things have come together to say, yeah, we have a good case here.
I feel like this brings up, I'm gonna ask one more and then maybe we'll start opening up to see, I mean, I have a lot of content. But so I think this gets to this other point of like, how do you marry, like you talked about doing this like strategic science, like how do you think about marrying the research you're doing with the policy side? And I mean, I think about all the time, like our work in the clinic is often, you know, working with client organizations that don't have legal expertise, and they're asking us like, help me understand the law. Can I do what I want to do within the law, or how can I change like the goals, like the, you know, my business model, my social enterprise, whatever, to meet the law? Or like, how do we change the laws to like prioritize and benefit things that are better for health, better for the, you know, better for the environment? But like on your end, like how do you think about that? How do you make the decisions about like what to pursue and when, and like get it in front of decision makers?
Yeah, I mean, and I just want to make one point about working with lawyers, which I really enjoyed. And I wish I'd gotten a dual degree. Because I had the pleasure, when I was at the Rudd Center, which was based at Yale at the time, Jen Pomeranz, who you certainly know, maybe others are familiar with, but she's a food law person. And even at the level at which I was designing studies, I was testing food labels at the time. And I would run her survey. I would run my surveys by her, because she would have input like, I was trying to figure out if people wouldn't understand a certain type of label. And she was like, you need to ask if it's confusing, because that is what you would need in a court of law, like to demonstrate that people are confused by it. And so we literally like edited the survey to match on. And so to have that in-house expertise shaping exactly how we're even doing the research to maximize its ability to inform legal issues was super valuable.
And just to say on that, like it's because the courts can say, is this false or misleading? So if people say they're confused, you can say it was misleading.
Exactly, right.
Totally.
Right, which I, you know, it was a simple change, but like I would have never known that. But we are very, like, if you think about traditional researchers, you know, the standard approach, which is good and needs to continue, is like you ask questions that you're curious about and that your field thinks is important, or maybe even just you think are important. And then you go do your science and you publish it. The strategic science approach we take, and it's not all the work we do, but we at the start of the research process, and it's such common sense, but we kind of scan the field of like, who are the decision makers in this space, and we want to build that relationship. And we reach out to them to basically say, hey, what do you think we should be studying? Like, what are the burning questions you have to advance policy? And so they often have input into our research questions. Now, you have to be careful, right? Because our number one priority is doing high quality rigorous research and that not being biased by a policymaker that has an agenda, right? So we're really just helping, they help shape the questions. We then go off, we do our science, but we work hard to cultivate and keep the relationship so that we can then present to them what we find and they can actually use it because they've had input at the outset and they've helped tailor that question. And we do things like pre-specify our analyses and make our data public, you know, just assure that we're transparent and people realize like we have not just provided a policymaker with an answer that they want. And we've had a lot of, and I will say like the strategic science projects we've done, they've had some good impact and they've been the most rewarding because I think scientists tend to think like we're so smart, like we have so many good ideas. The people doing the actual work in the real world have the most interesting ideas because they're like dealing with the problem day in and day out and trying to figure out how to solve it all the time. So like they've always brought to me, I think, my most interesting ideas and projects. So I love doing partner work like that.
And you know, like especially in this moment, we're talking about this like RFK, Make America Healthy Again, suddenly like a flood of new like proposals. So one important time to then be saying like, okay, like no one has yet studied this. Like what is the impact of this? Should we do this? Should we not do this? So,
Yeah.
like, they're gonna be busy.
Yeah, I hope so, yeah.
Before I go on, let's see what questions we have from all of you. There we go. Akif, do we need a mic? Should we use a mic? I see Laura and then I see someone over behind you, Akif.
I can probably go without a mic.
I think it's probably okay too. I know.
Okay.
We are recording, but I think you seem to be close to the camera, so.
Okay. Thank you so much for being here and speaking with us. I was curious if you have considered the legal and policy infrastructure that needs to be in place before removing these ultra-processed foods from the food supply, with the knowledge that a lot of low-income people do rely on ultra-processed foods to be cheap and accessible and shelf-stable.
Yeah, so I actually am not saying remove these foods from the food supply because good luck, right? So I'll give you an example, like, let's be very specific. Getting ultra-processed foods out of schools or really reducing them being served in schools, that is not focused on putting the onus or the burden on consumers, right? That's us saying we are going to decide to use money to invest in building infrastructure in schools like scratch cooking kitchens, and other programs so that children, when they show up at school, are going to be served a healthy, nutritious lunch, just as happens in many other countries. Like Japan is obviously always used as the example for amazing school lunches, right? Do I want like a school lunch like that for kids in America? Yes, and I absolutely think dollars should be spent, and that's not putting onus, on the consumer. And that could be paired with universal school meals, right, which is a policy that essentially makes school meals free and accessible to everyone, which takes away that stigma of certain kids, saying like they have free lunch, others don't. As opposed to like, let's just wipe them all out of the supermarket. Like, no, so I think we have to be specific about which policies we want to prioritize and invest in, and that to me would be an obvious one, precisely for the reason you're talking about.
Thank you also for the time. I'm really interested in the way that you conceptualized the prospect of this potential litigation with tobacco's litigation. I feel, in my lowly second-year law student experience, feel like the best transposition of that framework is with microplastics, right? And like similarly, on both, in both cases, so to speak, you have that causal diffusement that is difficult to prove in court, and I'm wondering specifically also about the role that state AGs play in pushing those that litigation, like the Philip Morris cases of yesterday and like the 3Ms of today, and now that more electeds are kind of getting on the train, are you thinking about like, I guess like even just like state AGs or like what other legal sources do you feel like are your best allies at this juncture?
Yeah, I want you to answer this because I can tell you that we're always like, state AG should care about this, let's engage them. But I have not, we've never seen like interest retraction, but you might have more.
So I think, I think there's like a lot of litigation kind of percolating around. So one other thing which I didn't mention that has been an issue that wouldn't necessarily be a bar to state AGs, I think it would be another reason they'd be beneficial, is that after the Perelman case, a lot of states passed laws that provide immunity to food companies for obesity and diet-related health harms that come from what they eat. So I think it's at this point like more than half of states. Interestingly, like red and blue states, so it's pretty like kind of all over the map who did this. So there's actually been like a real difficulty in certain states with doing this litigation. I think there's been a lot, like we've been in a lot of conversations about like can we get AGs involved, and I actually think a lot of the snowball is going to is sort of getting more people aligned around a narrative around like how bad some of these foods are in a way that before I think people like didn't want to undertake it. Like the science, like they didn't really understand it, they didn't feel like it was clear enough. It felt like politically, political suicide. But now that we have like all these red and blue states like putting out these laws, there's like, in addition to those I mentioned, there's these like Make America Healthy Against state laws that do other things. There's like a Make America Healthy Against caucus. So I think I do think we're gonna like see more uptake as a result of that. But I think it has been tricky, and where the litigation's been tried, it's like not been that successful. Yeah.
Thank you.
Great question.
Thank you for sharing. I'm wondering if you have seen any studies comparing all those strategies you have mentioned in terms of the impact on the behavior change and also associated cost. And what's your priority in terms of policy recommendation? Thanks.
Yeah, you're saying studies. Were you saying studies that compare the different policies to each other? So there are a couple of groups that do these cost effectiveness analyses, which are great. The problem is those are based on assumptions, right? And so those analyses are sort of, those models are only good as the assumptions you put into them, and but where we do have a lot of good data, and I think it's very well supported at this point. Taxes, unhealthy ultra-processed food taxes and beverage taxes always come out as the most cost-effective, right? Because first of all, taxes produce large behavioral effects, and we're now starting to get data on at least some small health improvements, reductions in BMI in places that have these taxes,
some reductions in even gestational diabetes among pregnant people, places that have these taxes. Taxes generate revenue, like that's why they're so, and they're you know, there's a lot of anti-tax sentiment, but they're appealing in the sense if a city or a state needs money, they serve this dual function, and so that tends to be like the most cost effective. There are other, Steve Gormaker's group at Harvard has run a lot of these models. There are some things that you'd probably be surprised by, like they've modeled like exercise, you know, extending and making sure schools have like longer recess periods or like more time for exercise, and actually that doesn't really produce any effects. So it ranges, but I would say taxes are kind of my number one. I think ultra processed foods out of schools is like huge on my list, maybe even tied with taxes. I do think labels and warning labels, though they're not going to produce huge behavioral effects, serve a very important function in that they do educate. Like there are many drinks, for example, that people do think are healthy, like fruit drinks and Gatorades, and so I think they serve a basic educational purpose. And to our point earlier, once you label the whole food supply, it makes it way easier to do other policies. Like now you can't market those foods to kids, etc. So that's another policy I'm in favor of. Marketing restrictions, I love, but that's up to you guys to figure out how we can do that. Like that's an incredibly hard one.
From like a First Amendment
perspective, yeah. But that, you know, if there are ways that we can get some of those marketing restrictions, I think that would also be hugely helpful. And then finally, I mean, those counter marketing campaigns, when you talk about cost effectiveness, now through social media, it is way cheaper to run campaigns like that than using traditional TV, radio, how we used to do it. So I think that starts to approach a more cost effective approach, and that's also something that you don't need a policy for. Public health departments can do it, states can do it. It's just running those campaigns.
I was gonna add one really quick thing, and then we'll go to Lauren up there. Is that okay? So just the I think because like on the tax thing, like we did, you know, delving one layer deeper, because a lot of the pushback that we hear is like, well, these taxes are regressive because, you know, because they're static, like based on the cost of the drinks, that they affect poor people more. And so I guess, I mean, I have my response, so I'm curious, like, if you want to say your response to it, and it might be the same response.
Yeah. So I have two responses to this. I mean, one is, like, I think it really matters how the tax revenue is used to offset that concern. So in Philadelphia, the tax revenue, at least a good chunk of it, was used to expand high-quality pre-K education in low-income communities and Black and Brown communities in the city. It also is used to rebuild infrastructure, meaning parks, libraries, rec centers. And it built out this community schools program, which was offering like a lot of behavioral health, mental health services in low-income neighborhoods. What a great use of tax revenue, right? And will probably produce tremendous public health benefits. Like if there's one thing that leads to good health, education, you know, high quality education is one thing. So to me, like, if you're using the revenue in those kinds of ways, to me it offsets a lot of the regressivity concern. Now the usual argument that I make and people in public health make is, look, these diseases are regressive, right? So there's a disproportionate burden on lower income folks. They have higher rates of type 2 diabetes, they have higher rates of cardiovascular disease, they have more aggressive targeted marketing, they live in neighborhoods that lack choice, that companies, you know, exploit. These products are very, very cheap, they're harming their health. And so we have a pattern, a distribution of disease that is more concentrated in those neighborhoods. To the extent that these taxes improve health, that group will benefit more because they will also save more money later on healthcare expenses. Now, we are not at the point where I can show you the perfect data chain that is definitely happening, so I can't tell you that will definitely happen. But it's logically following that these health improvements should, you know, theoretically lead to those savings.
When I like your Medicaid data sort of is getting to that a little bit with, you know, maybe not the full range of disease, so that, which is I think a
Yes.
benefit of like that.
Yes. And dental expenses are huge. They're really expensive.
Right. Sorry, Lauren.
Okay, thank you so much for being here today. My question is going back to the tobacco analogy, and I find the whole like throw the tobacco playbook at food analogy very compelling, and I'm just curious, from your perspective, what do you think the holdup has been, and in particular, are there any places where the analogy falls apart? Are there any places where it's like, oh, food like really doesn't look so similar to tobacco here, and how would we get around that or address it potentially?
I think the holdup has been the food industry.
you know, like, there's just a lot of money to be made selling these foods, and they lobby really hard. There's countless examples of it. Policymaker, like, the kind of the classic, like, it's our system, and then they get paid, and then they don't support the policies, and so, not to reduce it to just one thing, but I think that is, like, a lot of it. I do think some of the holdup is people do, like, you know what I love about RFK saying this, again, but, like, finally someone being like, no, and trust me, I'm not an extreme person, but like, we're poisoning our kids, like, people don't view food that way, like, they just haven't, they're just like, they're Oreos, and I ate them at the Super Bowl growing up, and Cheetos, and like, these aren't bad, like, we just have these positive associations. It's hard for us to think of food as that bad, as bad as tobacco. That's why I think this narrative change and public health messengers actually saying, no, it is making us super sick. I think we need that narrative change to make progress, in addition to someone willing to take on industry. And I don't know where it falls apart. There's got to be examples. I just don't have any. I welcome critiques.
I will say on that too, and I think like now I'm speaking to the choir because I know you know this from our work, but like FDA itself is like incredibly risk averse. Like some of it is like in some ways, you know, as far as agencies go, unlike the USDA, I think there's less conflicts of interest inherent in FDA. But like they'll take forever to do like the most basic thing, and you know, I think they don't want to take any risks at all. So again, I mean, to the extent there's a narrative change, and who knows what will come, I think my hope is maybe that they'll like be willing to like peek their head out and be like, oh, people out there want us to actually take care of them and have healthy food. That's safe.
Yeah, I mean, FDA gets political pressure, but like, and I have friends at FDA, and I think they've done some great stuff, but they spend a lot of time working on the health label.
Which is voluntary.
To put a healthy label on some packaged foods. Like, we have voluntary sodium targets that need to be made mandatory. Like, that's another policy. Like, sodium regulation? Oh my gosh, like, no brainer, cost effective. But they worked on the healthy label.
So let's take a couple more, and I recognize that people have class and you have to head out, whatever, maybe we'll go like 3 or 4 more minutes, and I saw a hand.
So I'm very much with you that Oreos are dangerous to have in the house. So it seemed like, if I'm remembering correctly, back in kind of the Obama administration, when Michelle Obama in particular was really pushing a lot of healthy food stuff, a big backlash was kind of a personal autonomy, for lack of a better term, the anti-nanny state movement, right? That the government's not only regulating your public life or regulating corporations, but now it's telling you what you can drink and what you can't, and it's going to tax you and make, stuff like that. How do you respond to that persuasively, or do you find that that's less of a response now, and that people have sort of moved on from that objection now that it's becoming more of a bipartisan issue?
Yeah, I mean, that's also another good answer to your question, because you're absolutely right. It's just, in this country, there's been such a stay out of my food, don't tell me what to do when it comes to eating. It is funny to hear you say, like, now that it's a bipartisan issue, because it's literally like 3 months ago, like, this suddenly became, and I'll give you an example. Like, we had written a perspective piece in JAMA that a health staffer in the senator's office saw and reached out to us. It was a Democrat. And they were like, loved your piece. What are your ideas on food policy? And we were like, yes, here are all our ideas. The staffer came back, said, talk to the senator, doesn't want to touch it. Culture war issue, doesn't want to get into it. Trump gets elected, they circle back, they're like, hey, Senator's really interested in food, like, this is a great reach across the aisle moment. Like, it's just like that, because for literally, at least the 20 years I've spent in this field, like, that has been a huge issue. When Bloomberg introduced portion sizes on sugary drinks in 2012, like, people lost their mind. So this is just fascinating that the Republican Party is embracing this, and that is huge.
All right, one more.
Yeah, just last night, coincidentally, before this talk, I saw that USDA canceled like $1 billion in like school food grants for healthy food. And I know you mentioned the USDA chief is very different from RFK Jr. So I'm just wondering if like states are very interested in like suing in like the litigation aspect too. Like there's 40 states or whatever, red and blue states now interested in that. Do you think they'll step in and fill the breach funding wise, or do you think they're only interested in like performative, maybe litigation, but they're not actually interested in putting their money where their mouth is?
Yeah, you're saying, like, is the government actually going to do any of these things because, hey, they just cut all this?
Yeah, especially state governments.
state governments.
Yeah.
Yeah, I mean, I don't know. I mean, my honest answer is I really don't know. And where are they gonna get? Do the states have the money to do that? And, you know.
I will say one thing, like, even though I think we did point to, and there are big differences between FDA and USDA, at her confirmation hearing, Brooke Rollins, who's now the secretary for USDA, was asked specifically about ultra-processed food in schools and, like, sounded receptive to thinking about, like, how do we address that issue. So I don't know where that goes. Certainly getting rid of grants for healthy food seems to be going in the wrong direction for that, but I think, you know, and again, I think that's where, like, a little bit of this, like, there's a lot of different narratives and ideologies at play, so I don't know where it will end up, but I do think that they may want to take the food away, but they may be willing to also think more about bigger restrictions. And so do with that what you will. It's a good question.
Yeah, there is so much remains to be seen what actually comes